back. Gentleman yields back. The gentlelady from Pennsylvania, Ms. Wild.
Thank you, Mr. Chairman. Good morning, Secretary Becerra. Good to see you again.
Yes.
Nice to see you yesterday. I want to use my time today to talk about a pressing issue, the mental health of our hardworking first responders. As you well know, law enforcement officers die by suicide at a greater rate than the general population, and we must do more to support them. I'm proud to say I took action and secured millions of dollars in funding in the American Rescue Plan to support the mental health of our public safety officers. Under your leadership at the Department of HHS, the funding I secured has been awarded in grants to entities in Georgia, Colorado, and in my home state of Pennsylvania, and is now working and getting results. I know this funding is working to develop and implement training, tools, and resources designed to reduce and prevent burnout, depression, anxiety, suicidal thoughts and actions, and substance misuse. But could you please share more about how this funding is having an impact?
First, I have to begin, Congresswoman, by applauding you for the work that you've done on this issue. Having served as the Attorney General, therefore the Chief Law Enforcement Officer of the largest state with the largest law enforcement force in the nation, I can tell you how many of our men and women are suffering true stress. Every year, we would have a ceremony to acknowledge the fallen officers in California. I can't tell you what men and women go through, and it is more than appreciated what you're doing to try to help folks who are in public service protecting us day in and day out. We're going to work with you on your legislation. Thank you for your support of the Learn to Brain Act, which made it possible for us to provide first responders with more services, access to care. And I hope what you'll continue to do is work on trying to remove the stigma that occurs when a law enforcement officer has to seek out mental health services. Oftentimes I've been told, better not to do it because don't want that on my record. I want to be able to get promoted, and I don't want anyone to think that I'm suffering from some kind of mental stress, because that might endanger my chance to go get promoted. So we have a lot of work to do. Men and women, I mean, things have gotten very complicated when criminals are better equipped with weapons than our law enforcement officers. There is real stress, and I thank you for what you're doing, because it's an untold story of how much stress some of our first responders and law enforcement are going through.
Well, thank you, Mr. Secretary. I look forward to working with you on this as we go forward. Are there other things that you are aware of that we can specifically support using the ARP funding or supplemental funding to make sure that we are supporting our first responders?
Well, above and beyond providing this resources for further training and access to support, trying to make sure that the privacy of officers is protected when they do seek mental health services, I think it would be important to continue the trend in some communities where first responders, especially, for example, are homeless, doesn't always mean the 911 call goes to the local police department. So this way, if it is going to be someone in a uniform, law enforcement uniform, they have someone who's prepared for as a mental health professional, as a substance use health professional, or as a social service health professional, so that the response is addressing the actual need of the person that's on the streets and for the reason the 911 call was made. I think that would help our law enforcement officers tremendously. There are some law enforcement agencies that actually now have some of these professionals right along with their officers to be able to do the response the best way possible. But the more we keep our officers focused on what they were trained to do, protect and serve, the less we're going to have situations where not only is the individual who was the subject of the 911 call, but the officer become victims of what could end up being a bad circumstance.
Thank you for that very thoughtful answer. In the 116th Congress, I co-introduced just such a bill with Representative Beasley of Illinois. And, you know, sometimes my colleagues on the other side of the aisle have derided this notion of people with mental health training accompanying police officers. But what I have heard from police officers in my district is that it would be welcome. We are not looking to supplant the role of law enforcement officers. We are simply working to assist them with that type of legislation. Thank you very much, Secretary Becerra.